is the Emergency Medical Minute.
All right, this is a super short one. So hyperkalemia, something we see commonly. We don't always act on it, but in more severe cases, we can get EKG changes. The EKG, you can't always correlate to a specific potassium level. So for instance, if you're a chronically high dialysis patient, you might have a potassium of 6.5 with no EKG changes. And if you just acutely had, say, Lancey, accidentally push 175 milliequivalents of potassium chloride through your IV, and you were a normal person, then you would definitely have EKG changes with 6.5. So does anybody remember the first sign? This is normal EKG. First sign of hyperkalemia on an EKG. Peak T waves. That's right. I went far away. All right. So peak T waves. Other things that can cause us peak T waves? Any other conditions? So it can be a normal variant. It can also be findings of acute ischemia. People will say hyperacute Ts when referring to the very first signs of an acute MI before we get the big ST elevation. All right, so now it gets harder. We all remember the peak Ts. What's the next stage of EKG changes? So the P wave actually tends to flatten out. So that's the next stage after the peak T waves. And then the next stage, anybody know? So it's Qrs widening generally. And are there other things that can give us Qrs widening? Actually, there are tons of drugs that give Qrs widening. A Benadryl overdose can give you Qrs widening. Typically, these old school tricyclic antidepressants that we sometimes use for nerve pain now, those will give you Qrs widening. Generally, if you see Qrs widening, it means a drug, if it's a drug overdose situation, it's a drug that has sodium channel blocking properties, which includes Benadryl, even though we think of it as an antihistamine. And then the last stage, I remember the last stage, taking you back to like middle school mathematics. So we say a sine wave. Everybody remember their sine, cosine, and tangent? So the sine wave literally looks like just an up and down wave. You can kind of see on the EKG right there. And this is like a true mathematical sine wave right there. And then what's the last phase that we don't talk about so much because we don't like it? Yeah, ventricular fibrillation and death. So we hope to intervene before that point, but just remember, for instance, if you see a hyperkalemic patient and they have Qrs widening, they're already kind of halfway down the pathway, and we probably need to intervene with some drugs to prevent further badness. That's it.
Thank you. Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.